The Philadelphia homeless drug problem. The 900 people in the encampments and 65% without housing are the face of the Philadelphia homeless drug problem. The city's limited housing supplies and lack of access to narc and overdose trainings are only a few of the obstacles these people face. However, these factors should not be ignored. Whether these people are addicts or not, they face an extremely difficult road to recovery. In this article, we'll look at some of the solutions to the problem. 900 people in encampments. A city outreach team is developing a by-name list of the people living in the encampments. Outreach teams are working to determine which people need services the most and where they can get them. They also help people get back on their feet by assessing their needs. They provide medication-assisted treatment on the street, and in some cases, Suboxone medication. The outreach team makes it clear that people in the encampments can expect to be moved after 30 days. The city has also lowered barriers to addiction treatment and expanded the capacity of the homeless encampments. However, the problem still remains. The city hopes that this settlement will lead to a peaceful alternative for the 900 people living in the encampments. The agreement cites an ongoing drug problem among the homeless population and aims to help them find jobs. Nonetheless, the homeless community has many questions. The Encampment Action Plan is a pilot project that has been implemented in 2 Kensington encampments. It was developed after a City of Philadelphia-sponsored study of best practices in addressing the opioid crisis in encampments. The pilot program has engaged a group of homeless individuals under the Kensington and Tulip Street bridges to provide ongoing outreach, coordinated services, and support. The city also plans to open new encampment action plans in the coming years. While the city has tried to help the addicts, the neighbors have also been pressing the city to remove the encampments. However, officials have had to weigh the needs of the neighborhood with the health and safety of drug users. City officials say that the encampments are a sanitation hazard and pose a health risk to both the drug users and the surrounding communities. Therefore, city officials had to find a solution that would satisfy the needs of the homeless and the community. 65% in housing. While the overall unemployment rate in Philadelphia is higher than the national average, the number of people living without a home is significantly lower. Approximately half of those in need of housing have some form of substance abuse disorder and cannot afford to pay rent. Pathways to Housing PA has a housing first model, in which people are provided with affordable housing without a precondition of sobriety or mental health problems. This model has been effective, with individuals receiving housing moving off substance use and into job training programs. In fact, those receiving case management are more likely to remain in stable housing for over a year. Since March, Philadelphia Housing Action has relocated 50 people into vacant properties, so the city does not have to evict these residents. Though officials have insisted that no one will be evicted, contracts on some properties may require them to be relocated. Despite this, the group is still struggling to find permanent housing for the displaced people. The organization has been moving families into vacant properties for 30 years. These efforts served as a model for protest camps around the country. The Office of Homeless Services has also started a rapid rehousing program for people in need. 25 people have signed up for this program, which focuses on assisting individuals with chronic conditions and the elderly. Rapid rehousing at hotels includes meals and services. The city is working to reduce the number of homeless in Philadelphia by identifying the causes and providing solutions. This has been a challenge for the city's homeless population.